My research group is mostly focused on preventing chronic disease starting in childhood, with a particular focus on childhood obesity. So our research is focused on two main areas. One is in identifying those children and adolescents who are at the highest risk of going on to develop type 2 diabetes and heart disease. And that's important because we need to identify those kids most likely to go on to those diseases in order to intervene appropriately. And the other part of our research is focused on evaluating novel methods of intervening. For example, we are doing studies looking at drug therapies. So once we identify the children that we believe are at the highest risk of developing these diseases, we want to intervene. Some of our research is focusing on drug therapies in the very highest risk children. Also, we're looking at behavioral therapies in some of the overweight and obese children and their families. Both of these are important. Behavioral therapy needs to be the foundation of anything that we do in children and adolescents, but some kids just need extra help, and that's why we're looking at various drug therapies. Some of the work we're doing relates to predicting those kids that are most likely to develop chronic disease, and we have different methods of doing that. For example, we use ultrasound analysis to look at the artery health of children, how well the blood flows, how stiff the arteries are. These are types of things that will give us a little bit of an idea of what may be down the road for these kids, to better stratify or pick the ones that we think are most likely to have problems down the road. We also are looking at novel blood markers, simple ways that we can predict those who are going to develop heart disease and diabetes. And we utilize the CTSI for many of our studies. And really what the CTSI does and what the CTSA grant is going to do is provide money to improve the infrastructure of clinical research here at the university. And what it does for us as individual investigators is allows us for our individual studies to be able to carry them out to the fullest extent, utilizing resources to do different types of testing in our participants, and also providing support such as biostatistical analysis support and database management and other aspects of our research projects that are very important.